So who should get a screening to see if they have airway issues? According to the ADA, every patient who gets an exam. Let me say that again. Every patient who gets a dental exam should be screened for airway issues. Welcome to another episode of the Irreplaceable Dental Team. Yes, we've switched from assistant to team because so many team members are finding this podcast valuable. So we're going to slash assistant and put the word team. So today we're going to focus on a relatively new aspect of dentistry, but oh so important. I am talking about dental sleep medicine. Dental sleep medicine? What does sleep have to do with dentistry? How does that work? All right, we're going to break it down today. So dental sleep medicine focuses on treatment related to sleep disordered breathing. That could be upper airway resistance syndrome all the way up to obstructive sleep apnea. And we in the dental office have so many opportunities. First of all, to see people the physician doesn't normally see, because folks come through our office for far more regularly than they will go to a medical doctor's office. So we get the grand opportunity to see and note things and be able to share with people in a relatively shorter time than a physician may notice it. Secondly, we develop such great relationships with our clients because we see them so regularly that it gives us the relational equity to be able to share things that they may not have heard of, but they openly listen to because we have that relationship equity. So let's talk a little bit more about dental sleep medicine and how it relates to the team and how it helps us support our clients. Now, dental visits always include an examination. Sometimes it's a general examination because it's a 6-month check and we're doing oral cancer screening and all of that. But sometimes it is an examination just because you're looking in the mouth in preparation for a procedure. And we don't just focus in on the one thing. We tend to look at the whole oral cavity. So the dental team plays a very crucial role in identifying patients at risk for obstructive sleep apnea during our dental visits through screenings and questionnaires and discussions about symptoms like snoring, daytime sleepiness, morning fatigue, morning headaches, brain fog, the inability to go through a day without self-medicating with caffeinated beverages like Coke or Pepsi or cups and cups of coffee or tea. Or upon questioning, we may realize that our clients are often sleep deprived because they wake up several times during the night. Sometimes they find it very difficult to fall asleep, and when they do fall asleep, they don't stay asleep. And sometimes when they wake up during the night, oftentimes they're just not able to go back to sleep. So through questioning, we can determine a lot. But also through an oral screening, we can see what the palate looks like, because that gives us clues. We can see what the tongue looks like. That gives us clues. We can also see various things like acid erosion, evidence of nocturnal grinding, evidence of clenching. Any one of these things by themselves don't really mean much, but together they can form a picture that will allow the dental team to say, hey, I'm seeing some things here that suggest that you may be having airway issues. So dental professionals can work closely with sleep physicians to diagnose and manage sleep disordered breathing and help patients to receive timely treatment and improve their overall health outcomes. So many of these clients have been going for years undiagnosed, and it's no shame on the physicians that they see regularly, but medicine has become so very specific that if you go to a physician with one particular concern, elevated blood pressure, they treat that. Or if your blood sugar is not controlled, they treat that. Or if you're not sleeping well at night, they assume insomnia and they treat that. And it goes on and on. You can treat the individual symptoms, but we know as dental sleep medicine practitioners that these things may all be caused from one single issue. So many times we can put all the dots together and say, hey, is this a challenge for you? Is this a challenge for you? Is this a challenge for you? These are the things I'm seeing in your mouth. Perhaps we need to do some further investigation. Now, once a client is diagnosed with an airway issue, whether it be upper airway resistance syndrome or obstructive sleep apnea, there are options. Two of the most popular ways of managing airway issues is with the use of reversible appliances. The continuous positive airway pressure machine, or CPAP, is one that puts air through your nose or through your nose and your mouth. Moist air that flows through that mask that keeps that airway open. And I'm defining the airway as a tube from the back of your nose going all the way into your lungs. And so when the patient puts it on, it helps to keep the airway open so that they can sleep comfortably at night, so that they're less likely to wake up during the night, so that they're less likely to stay in light sleep and they're actually able to get deep sleep, and so that their overall health improves. The other appliance is a dental appliance, and its method or mode of action is totally different. It does not keep that airway open by sending pressure through the tube, but we know that the majority of the closure of that tube when we sleep is because this lower jaw rolls back. So we can fabricate, or send to the lab to fabricate an oral appliance that holds the lower jaw forward. We refer to that as a mandibular, because the lower jaw is your mandible, advancement device, or MAD. There are tons of them on the market, different designs, different materials, and a doctor who has been certified as one who is quite capable of managing clients with sleep disordered breathing can have an appliance fabricated to hold that lower jaw forward so patients can sleep comfortably without the jaw rolling back and closing off that airway. Because we know that we can live without food and we can live without water, but we surely cannot live without oxygen. So it's important for the dental team, every member of the team, to be fully aware of dental sleep medicine, what the oral manifestations look like, what the patient's hygiene practices should be versus what they are, and helping them to get to that point where they're ready to be evaluated to determine if indeed that person has sleep disordered breathing And if so, to what degree and what the options are. So there is definitely a collaboration between dental teams and sleep physicians and pulmonologists and other healthcare providers to create a comprehensive treatment plan of care for successful management of sleep disorders, specifically due to a lack of oxygen at night. The dental assistant can be aware of what the oral manifestations are, and while they are assisting the dentist, can bring to the dentist's attention these things that they may have observed. And of course, a well-informed dental assistant can invite the clients to complete a detailed questionnaire to determine if this is someone who needs to be referred for a sleep study. Now, a sleep study doesn't mean that we're determining if they're sleeping or not. What it is determining is what is happening during their hours of sleep. Is that airway staying open? Is it closing off totally? Is it partially closing off? Is it just being interrupted without decreasing the volume of oxygen? All of these things will help to inform the sleep doctor, aka pulmonologist, ENT specialist, any physician who has gone on to do further studies to fully understand how to evaluate and how to treat patients with sleep disordered breathing. And may I say that there are many hygienists who have gone on to be trained as orofacial myologists. Let me say that word again. Orofacial myologists. And these are specially trained persons who can help with oral habits that are positive to improve the airway flow by strengthening tongue and head and neck muscles so that the muscles of mastication function more optimally. Or train our clients to break habits that are very unhealthy and could lead to a narrowing of your oral cavity, which could lead to the tongue being pushed back to the throat, which could lead to a limited airway space. So the dental assistant, the dentist, the dental hygienist, and the dental technician play a vital role in dental sleep medicine, because a specially trained dental technician can fabricate the specific appliances needed to ensure that that client is able to keep that tongue, that lower jaw out of the airway space while our clients sleep at night. So we are one team that is imperative for the health of clients who may have sleep disordered breathing. Because they come in regularly, we can monitor them regularly. Now, the CPAP machine is calibrated and then given to our clients. An oral appliance is calibrated as our clients use them. So we have to monitor them until we realize that they've reached to the point with the appliance where they are able to keep that airway open without causing pain or trauma to the TMJ, without causing head and neck pain of the muscles that may be strained, and without causing movement of the teeth. Okay? So the dental team is able to manage, monitor, support, and educate clients who may have airway issues. Now, this means that our dental teams need to stay on the grow because there are always new research coming out on new products. There's a lot of money invested in marketing to say, hey, this is the next best thing since sliced bread. Or, hey, this dazzle, dazzle, razzle, dazzle thing is going to fix everything. And we know that great marketers can sell things that have absolutely no use or value to our clients. So we need to stay in that place of continuously learning and understanding new products and how they work to be able to have an informed opinion to share with our clients. Because once you tell them that there's a challenge, they are going to jump on that internet to see what's out there. And they're going to come and they have all their questions, as they should. And we as a dental team need to be prepared to respond to them from a place of knowledge. So, how can dental teams help our clients beyond taking care of the oral cavity? We can ensure that if we see signs that our clients may be struggling from overall health because their body is not getting enough oxygen at night, we can identify these clients, we can refer them, and if they opt to have dental appliances, we can help them calibrate and monitor. But even if our clients opt for a CPAP machine, we can see based on the oral symptoms if there's improvement, or if we may need to say to the sleep doc or the pulmonologist, I think this client needs to come back and have their machine calibrated because I'm seeing some signs in the oral cavity that suggest that this person is still having issues with acid bathing the teeth, or still having issues with clenching and grinding, still breaking teeth, still breaking restorations, fillings. If someone is always breaking teeth or fillings, red flag. Don't assume it's always the doctor's negligence or the material not being up to standard. Also consider the heavy forces that the patients may be placing on these teeth during the nights when they're clenching and grinding. Because clenching and grinding is one of the red flags that someone may be having airway issues. And we know that when people have airway issues, it may lead to uncontrolled hypertension. So if you're doing a medical history and this person is on 3, 4, 5 sets of medication to control their hypertension, red flag. If our patients have cardiovascular disease that has not been fully investigated to see what the cause is, it may be due to airway issues. If this person has diabetes that's not controlled, it may be due to airway issues. A stroke may be brought on because of airway issues. So what we can do for the health and strength and longevity of our patients, it's priceless. Absolutely priceless. So who should get a screening to see if they have airway issues? According to the ADA, every patient who gets an exam. Let me say that again. Every patient who gets a dental exam should be screened for airway issues. Because it can be so complex, treating airway issues is multidisciplinary. We do our part as a dental team, the pulmonologist, the sleep doc, the orofacial myologist, everybody coming together. Sometimes the cardiologist or the internist, we all have to keep each other in the loop. Ideally, it would be great to have one central place where we could note all the challenges that our patients are having, so that whether you're the primary care provider or the dentist or the pulmonologist or whoever, you can see and track all the symptoms and put something together that seems like a pattern. But we don't have all of that. So what we have to do in our capacity is do the best thing that we could ever do for a client. And that would be to identify a condition that is life-threatening. Because people with airway issues that go undetected, their lifespan is 10 years less than the average person. People who kind of drift away in their sleep, usually it's because they have airway issues. People who have conditions that medication seems not to be able to control often have airway issues. So what we do in the dental office is imperative to the health of these clients. And I want to tell you that people walking around with airway issues, there are far more of them than you could imagine. I would say maybe for every 10 patients that you see, 2 or 3 of them have undiagnosed airway issues. So dental team, know that we have a significant role to play, not just in the oral health, but in the overall health of our clients. Identifying, getting confirmation by sending to the specialist, working with other medical team members to provide the best possible care for our clients, being able to fabricate and adjust oral appliances if that's the route that our clients go, being able to identify the need for further investigation if the patient is already being managed by a CPAP machine, but you're seeing things that are suggesting that maybe it needs to be adjusted because the patient is still clenching or grinding or whatever. At the end of the day, let us commit to providing the best possible, not dental care, but the best possible care for our clients. Thank you for those who are already doing it. Thank you for those teams who are considering getting the knowledge that they need to make a difference. Thank you for those doctors who see the value in investing in themselves and their teams to ensure that the clients that you see, that you treat, experience optimal health because of you.
Dental sleep medicine is relatively new, but it is life-saving, life-altering, and life-extending. We owe it to our patients to be aware to the point that we can alert them to things that may be going on during their hours of sleep that they're not aware of, but may be literally stealing their health, leading to hypertension, leading to diabetes, leading to cardiovascular complications of the heart and a stroke. We may have patients who have continuous brain fog and they have no idea. We may have clients who are breaking fillings and teeth all the time, and they're not connecting that they're clenching and grinding. We may have clients whose teeth are consistently sensitive because they have acid coming up from their stomach in their mouth on a daily basis, or rather a nightly basis. And we can be members of a multidisciplinary team that can take our clients from ill health to good overall health. Let's not be the ones who allow our clients to die during sleep. Listen, life is better when we live, learn, and grow together. Share this episode. It may save a life. If you haven't yet, please subscribe.